Dear students, today we are going to talk about anxiety disorders. This anxiety disorder was earlier called anxiety, later on panic disorder and GAD were generalized anxiety disorder it was called. But later on, let us see what is normal anxiety first. Right. So all of you must have experienced anxiety one or the other time in your life. Like if you go for a first date or preparing for an exam, performing at a concert, giving a speech, moving from home to the hostel, climbing a tall ladder, anything can lead to anxiety. Even during exam viva, you become anxious, right? So there is apprehension, there is a nervousness, there is a tension, edginess, there will be nausea, sweating, trembling. But this is normal anxiety because it is transient, does not significantly interfere with a person's well-being, as well as does not prevent a person from achieving their goals. We know that many anxious students are very high achievers actually, right? So it is helpful rather than harmful, right? So anxiety is not always harmful. Anxiety is helpful, and but when we will call it pathological anxiety, so anxiety is a response that prepares us either to run or approach danger by producing stress hormone. So because of the situation which is perceived as dangerous, there will be a stress hormones, and depending on your cognitive abilities and your physical ability, cognitive call you will take whether to run or to approach the danger. Now, there are abnormal anxiety as well. When even in such a situation like first date, exams, this anxiety is persistent, excessive and inappropriate, very much in intensity, very high in intensity, it paralyzes you, it causes a lot of impairment, leads to dysfunctions like avoiding, I will not give exams, I will not study, and withdrawal. It can be considered as abnormal anxiety. So normal worry about specific events such as school exam, whereas generalized anxiety disorder, constant, chronic and unsubstantiated worry causing such as stress or social, even on small matters, person is very anxious. So, normal worry, we are able to control our worry to an extent, whereas in case of generalized anxiety disorder, it is uncontrollable. Normal worries, while unpleasant, don't cause significant distress, but here extremely upsetting and stressful. So, anxiety. What is anxiety and what is the difference between fear and anxiety? Fear is a response to threat. It is outside, here and now, whereas anxiety is future-focused fear. So, fear is from known causes, external, definite, non-conflictual threat, whereas anxiety is unknown, internal, vague, and conflictual in nature. So, according to DSM-5, there are few disorders, namely separation anxiety disorder, selective mutism, specific phobias, social anxiety disorder, panic disorder, panic attack, agoraphobia, generalized anxiety disorder, substance-induced anxiety disorder, anxiety disorder due to another medical condition, other specified anxiety disorder, and unspecified anxiety disorder. So this is the entire list of anxiety spectrum disorders according to why. Now let's talk about feelings. And our feelings create behavior, and our behavior in turn reinforces our thoughts. So this cycle of thoughts, feelings and behavior, how to break it? Now coming to stress cycle. In life, sometime or the other, there are difficult events, stressful events, and because of those this stressful event, we feel anxiety, which leads to physiological response like increased heart rate, breathlessness, tremors, dryness of mouth, and individual focus is in physiological response. Why it is happening to me now? Why I am trembling? Why my heart is pounding? So there is a concern about symptoms which cause or consequences. Right? What may have, whether I have some heart attack or whether it will lead to heart attack or what. And so the stressful event become more dangerous. And this cycle goes on and on. This vicious cycle is going on and on. It escalates. So anxiety presents itself in many different ways. Desire to control people and events, difficulty getting to sleep, feeling angry, agitated, defiance, having high expectations for self including schoolwork and sports, intolerance, struggling to pay attention and focus. So, there are a variety of ways in which anxiety can present. First common anxiety disorder is generalized anxiety disorder. With GAD go through the day filled with excessive and uncontrollable worry and tension, even though there is little or nothing to provoke it. Right? Even in a small matters, they are from the morning to the night. The person is anxious on a small matter, very trivial matter actually. Overthinking. How to recognize anxiety in yourself and others. Overthinking, avoidance, sweating, stomach issues, nausea, panic attacks, needing reassurance, lack of patience, trouble concentrating, procrastinating, constant worrying, trouble breathing, headache. It can lead to headache, tension headache. It's a very common term we are using. Insomnia, and memory loss. So these are the common symptoms. Many of you might also have anxiety problems. So this problem we can recognize that this is the symptom of anxiety. And it is a very common disorder basically. Anxiety disorder is a common cold of psychiatry. So causes of anxiety disorders is genetic, biological, developmental, socio-economic, and workplace related stress. Generalized anxiety is because of the decreased serotonin level 5-HT and increased norepinephrine level. So there is a stimulation of the locus coeruleus and it produces norepinephrine which increases its transmission and a state of heightened arousal that contributes to anxiety. In a generalized anxiety disorder, there is increased activity in amygdala and GAD may involve the disruption of brain circuits which connects the anterior cingulate cortex ACC and the amygdala and the dorsomedial prefrontal cortex to amygdala which may be involved in negative emotion regulation. And GAD runs in families and has a significant genetic component. So genetics play a very important part apart from other conditions. So GAD develop gradually and can begin at any point in the life cycle. The highest risk during his childhood and middle age. And like all anxiety disorders, GAD affects 2 times as many women as it does men. So it is very common in female. Risk factors like genetic predisposition, brain chemistry, family background, social influence, lifestyle factors, worrying or anxiety, worries that are difficult to control, poor concentration, feeling keyed up or on edge. Restlessness is also very common symptom. Headache and nausea is also very common in anxiety disorder. Dry mouth, fatigue, tiredness, difficulty sleeping, trouble sleeping, very, very common symptom. Muscle aches, tremors, hand tremors is also very common. Sweating, sensitivity to noise is also a symptom of anxiety. Constriction in chest. Many times such panic attack mimics like heart attacks also. Irritability, right? So there is an autonomic hyperactivity which leads to shakiness, feel pain, faint, wobbly legs, rapid heartbeat, choking sensation. GAD patients often suffer from other anxiety disorders such as social anxiety disorder, substance abuse. Because to control their own anxiety, many times they take excessive alcohol among other symptoms. So this is self-medication in case of anxiety disorder. Behavioral symptoms of generalized anxiety disorders. Inability to relax, enjoy quiet time or be by yourself, putting things off because you feel overwhelmed, avoiding situations that make you anxious. So there are behavioral components of generalized anxiety disorder as well. So there is a DSM-5 criteria: excessive anxiety and worry, apprehensive expectation occurring more days than not for at least 6 months. The individual finds it difficult to control the worry. Person cannot control, and the anxiety and worry are associated with 3 of the following 6 symptoms. Right, like restlessness or feeling keyed up on edge, being easily fatigued, difficulty concentrating, irritability, muscle tension, sleep disturbance. So these are the common, and it causes clinically significant distress or impairment in social, occupational functioning. The disturbance is not attributable to the physiological effects of a substance, and it is not because of the hyperthyroidism or a drug abuse or medication, and the disturbance is not better explained by another medical disorders. Coming to specific phobias. Specific phobia results out of an irrational fear or a meaningless fear arising as a result of a situation or a specific object. We all have a rational fear, but this is irrational fear. Right. So it can be grouped into 4 major categories: natural environment, right? Phobia of water, dendrophobia of trees, animals. Very common is animals, right? Like lizard, dog, and horse. Right? It has been given the name, but you don't need to remember all the names. Otherwise, there is a dictionary, right? Mutilation and medical treatment, like from dentist or injection. trypanophobia, hemophobia. Looking at the blood, many times people can have a phobia. It leads to anxiety. Situations, claustrophobia, closed spaces, aeroplane. So many people cannot travel by air because they have a huge fear. And so there are many other conditions, specifically one's own life experiences. For example, a person who has been bitten by a dog will develop a fear of dogs. Another fear could also result of a traumatic experience from a car crash. So that is, if the car accident, the person will not be ready to again sit in the car. Spiders, snakes, heights, crowd, dogs, small places, jumps, flying, public speaking, failure, arachnophobia, birds, water. So these are the common. Marked fear, according to criteria, marked fear or anxiety about a specific object or situation, like flying, heights, animals, receiving an injection. The phobic object or situation almost always provokes immediate fear or anxiety. The phobic object or situation is actively avoided. This is very important. Avoided or endured with intense fear or anxiety. Fear or anxiety is out of proportion to the actual danger caused by the specific object. The fear, anxiety or avoidance typically lasting for 6 months or more. So this is also very important. It must last for 6 months. Fear, anxiety or avoidance causes clinically significant distress or impairment in social, occupational and other important areas of functioning. So now the person is not able to go to the school or to the job. Coming to the social phobia, fear of social situations where you may be embarrassed or judged. You will be closely scrutinized. So you will feel difficulty. Common physical symptoms are blushing, diarrhea, sweating, tachycardia. People facing social phobia are scared of public interactions and group association. Mostly they don't go out, they don't go to the party, right? Causes of social phobia may be heredity or environmental. There is a high possibility that a child born to a parent with anxiety problem will inherit it because of the hereditary factor as well as environmental factor. Both will work here. Right. Many other risk factors like genetics, observing others with social anxiety disorder, early traumatic events, parenting style, isolated upbringing, brain structure may be like that, and societal expectations. Like girls, earlier times girls used to blush and it was considered good. So the social prescriptions, comorbidity leads to anxiety, mood features, bulimia nervosa, and to get out of it, person may take substance also. So these are the common comorbidities. Right. So marked fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny by others. So scrutiny, examples include social interactions, having a conversation, meeting unfamiliar people, being observed, and performing in front of others. Right. The individual fears that he or she will act in a way, also anxiety symptoms that will be negatively evaluated. Social situations almost always provoke fear or anxiety, and the social situations are avoided. So people avoid or endure with intense fear or anxiety, and the fear of anxiety is out of proportion to the actual threat posed by the social situations. At least 6 months duration is very important, and it causes clinically significant distress or impairment in social, occupational and other important areas of function. Coming to agoraphobia, fear of places or situations that might cause you to panic and make you feel trapped, helpless, like a lift or small room or overcrowded market. So all can lead to agoraphobia, from where escape is difficult. Fear of being alone, these are signs and symptoms of agoraphobia. Fear of crowds, fear of leaving home, fear of public places, feeling detached from others, and huge anxiety. So there is a marked fear or anxiety about 2 of the following 5 situations: using public transportation, being in open spaces, being in enclosed places, standing in line or being in a crowd, being outside of the home alone. So the individual fears or avoids these situations because of thoughts that escape might be difficult, right, or help might not be available in the event of developing panic-like symptoms. And it is out of proportion. And this avoidance is persistent, typically lasting for 6 months. If another medical condition is present, the fear, anxiety or avoidance is clearly excessive. Now coming to panic disorder. It is highly unpredictable. Feelings of impending doom. There will be recurrent panic attacks, and there will be intense apprehension that physical discomfort, fear or terror. So the panic cycle is, there will be first panic attack, will be deno, but there is a fear of another one which is known as anticipatory anxiety. So it will lead to more anxiety. Right. It will lead to another attack which will further increase the fear, and this cycle, panic cycle goes on and on. So nausea, chills and hot flashes, sweating, trembling, numbness, dizziness, hyperventilation, palpitations, as if I am going to die, impending doom. It mimics like a heart attack also. So, coming to the diagnosis of panic attack, the recurrent unexpected panic attacks. A panic attack is an abrupt surge of intense fear or intense discomfort that reaches a peak within minutes, maybe 10 minutes, and during which time 4 of the following symptoms occur: palpitations, sweating, trembling, sensations of shortness of breath, feelings of choking, chest pain, discomfort, nausea, feeling of dizzy, chills, paresthesias, derealization. Here, derealization means feeling of unreality, or depersonalization, being detached from oneself, fear of losing control, fear of dying. This is also very important. Criteria B, at least one of the attacks has been followed by 1 month or one or both of the following: persistent concern or worry about additional panic attacks or their consequences; significant maladaptive change in behavior related to the attacks; behavior designed to avoid having panic attacks, such as avoidance of exercise or unfamiliar situations. The disturbance is not attributable to the physiological effects of a substance. So, if someone is taking alcohol or any other abuse, drug of abuse, then it should not be attributable. Another medical condition like hyperthyroidism, cardiopulmonary disorder, it should be excluded. Disturbance is not better explained by another mental disorder So panic attacks do not occur only in response to feared social situation, as in social anxiety disorder, in response to circumscribed phobic objects. So it can happen to many other conditions as well. Right. Comorbid mood and anxiety disorders. It is very common. Right. Major depression and anxiety disorders are very comorbid. Actually, they are like brothers and sisters. Substance-induced anxiety disorder. Prominent symptoms of anxiety that are judged to be the direct physiological consequence of a drug, of abuse, a medication, or toxic. Alcohol is very common. Caffeine, cannabis, phencyclidine, opioid, sedative, hypnotic, amphetamine, even cocaine can lead to anxiety disorder. So panic attacks or anxiety is predominant in the clinical picture. There is evidence from the history. So we have to take a very good history. Physical examination, laboratory findings, the symptoms in criteria A developed during or soon after substance intoxication or withdrawal. This is important. Even during the intoxication or even withdrawal or after exposure to a medication, the involved substance medication is capable of producing the symptoms of criteria A. And the disturbance is not better explained by any anxiety disorder. The disturbance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. There are many medical conditions which causes anxiety, like thyrotoxicosis, hypoglycemia, pheochromocytoma, carcinoid syndrome, temporal lobe epilepsy, drug intoxication, mitral valve prolapse, supraventricular tachycardia, coronary artery disease, asthma, and chronic obstructive lung disease. Many neurological disorders also. Many endocrine disturbances also. Also can lead to many other disorders also. Leads to the same. Toxic conditions also, like alcohol, caffeine, cannabis, uremia, porphyria. Many drugs also can cause such symptoms. Now coming to the measurement tools. We have to measure the level of anxiety. For that we have a Hamilton anxiety scale, which is widely used. Another is a GAD-7 anxiety scale. Right. It is a Likert scale. So there is a 0, not at all, several days 1, more than half the days 2, and nearly every day 3, which is maximum. Right. And we can grade 0 to 4 minimal anxiety, 5 to 9 mild anxiety, 10 to 14 moderate anxiety. And it is reliable, validated, adequate sensitivity and specificity. So this scale can be used for hospital anxiety and depression scale. This is also very important. Take anxiety inventory. This can also be used. So don't. Thank you very much.